Are your feet or ankles swelling after starting amlodipine? This is one of the most common side effects of this blood pressure medicine. In this video, I'll explain the main side effects of amlodipine, their symptoms, risk factors, prevention tips, and end with some practical pharmacy tips. The most common side effect of amlodipine is swelling in the feet or ankles, called peripheral edema. Patients usually notice tight shoes, visible swelling around the ankles, or heaviness in the legs. But this side effect is not caused by dangerous fluid buildup like we see in heart, kidney, or liver disease. Instead, it happens because of the way the medication works in the body. Amlodipine relaxes the small blood vessels to lower blood pressure. But this also causes more blood flow pressure in tiny capillaries, which pushes fluid out into surrounding tissues, leading to swelling. This side effect is more likely with higher doses and long-term use. For example, higher doses like 10 mg have a higher risk compared to lower doses like 2.5 to 5 mg of amlodipine. With long-term use, especially beyond 6 months, the risk of developing swelling can also increase. Swelling may also occur more often in women, and in people with conditions like diabetes or vascular diseases, which are conditions affecting the blood vessels. There are some ways to reduce the risk of swelling. First, using the lowest effective dose of amlodipine can help lower the chance of this side effect. Second, if you notice even mild ankle swelling, regular monitoring and early reporting can help prevent it from getting worse. And finally, try to stay physically active and avoid prolonged standing, as this can also help reduce fluid buildup in your legs. What to do if swelling occurs? The first step is to elevate your legs and monitor your symptoms to see if it improves. If the swelling continues or becomes bothersome, you should discuss it with your doctor. In some cases, your doctor may lower the dose or change your blood pressure medication if needed. Another common side effect of amlodipine is flushing, which means a warm and red feeling in the face or skin. Why it happens? Amlodipine relaxes the blood vessels, which can increase blood flow near the skin and cause this warm and red sensation. Flushing skin can be more common with higher doses, especially when first starting amlodipine or after a dose increase. In many cases, flushing improves as your body adjusts to the medication. To reduce the risk of flushing, avoid excessive heat, spicy foods, and alcohol. The next side effect can affect your balance and daily activities, especially if you are older. You might feel a bit dizzy or unsteady, mostly when standing up. Some people describe it as lightheadedness or like the room is spinning. This can happen because amlodipine lowers blood pressure, which may temporarily reduce blood flow to the brain and make you feel lightheaded. Some factors may increase the risk of this side effect, which include starting amlodipine for the first time, increasing the dose of amlodipine, being older, or taking other blood pressure medications. To help reduce or prevent dizziness, try standing up slowly, avoid sudden movements, and stay well hydrated. In addition, with your doctor's advice, treatment usually starts from the lowest effective dose of amlodipine and is increased gradually if needed. Another possible side effect of amlodipine is fatigue, which simply means feeling more tired or low in energy than normal. This is mainly due to lower blood pressure, which can sometimes make you feel less energetic or more tired. This side effect may also be more likely when first starting amlodipine, after a dose increase, or in older adults and people taking other blood pressure medications. To help reduce fatigue, try getting enough sleep, staying lightly active, and avoiding excessive physical strain. The next side effect can sometimes make people suddenly notice their heart beating faster or stronger than usual. Amlodipine works by relaxing and widening the blood vessels to lower high blood pressure. When this happens, the body may activate a natural reflex mechanism, a protective response that helps maintain blood flow and circulation. As part of this response, the heart rate can slightly increase. Some people may feel this as a faster or stronger heartbeat, known as palpitations. In many cases, palpitations improve as your body adjusts to amlodipine. Reducing caffeine and other stimulants may also help in some people. If palpitations become severe or bothersome, you should talk to your doctor. The next side effect is something many people don't immediately connect to amlodipine. You may sometimes notice headaches, especially during the early stages of treatment. The mechanism of this side effect is also related to the action of amlodipine in the body. As the drug relaxes blood vessels to lower blood pressure, cerebral blood vessels may also relax, and this can trigger headaches, especially in people who are prone to headaches. This side effect may be more common when first starting amlodipine, after increasing the dose, or in people who are more sensitive to changes in blood pressure, such as those with a history of migraines or long-standing high blood pressure. To help reduce headaches, make sure you stay well hydrated and rest in a quiet environment. Avoiding skipping meals and maintaining regular light meals may also help. Before we finish, there is one rare but important symptom you should be aware of. In rare cases, some people may notice shortness of breath while taking amlodipine. This is not common, but if it happens, monitor whether it is new or getting worse, and do not ignore it. You should contact your doctor for proper evaluation. Here are some important pharmacy tips you should not miss. Always take amlodipine at the same time every day for a consistent effect. Do not stop the medication suddenly without your doctor's advice. If you notice any of mentioned side effects, monitor them and report if they become persistent or bothersome, and regular blood pressure monitoring is very important to make sure the medicine is working effectively. If you found this video helpful, make sure to like, share and subscribe to replace medicine worries with real knowledge.